you ever had a lump or a bump or a cough or a concern of some sort and you've put off going to see the doctor? Lots of us have. We think, oh, she'll be right. It'll be fine. I'll go next week. I'll go the week after. What's behind that? Why do we do that? Why do we put off going to the doctor? Psychology consultant and author Dr. Jo Lukens. I had a chat to her about just that.
It's one of those things, isn't it, that it's so common for people, and we know that many people delay their medical procedures because of some sort of fear or concern. So it's either that I'm going to get bad news, or it's going to be painful, or it's going to be uncomfortable or embarrassing. So we know those are lots of the reasons why people go, oh, I'd rather not.
Avoid.
Yeah, avoid. And with that avoidance, obviously, can come some worry and perhaps some anxiety, embarrassment. Maybe you've had negative experiences in the healthcare system before that's made you uncomfortable with that. But of course, we know, unfortunately, these factors, if we continue to avoid, then we may end up dealing with something much bigger down the road.
Yes, I don't think anyone that's had a serious diagnosis went, I wish I hadn't have gone so early.
No, doesn't that happen too often, I wouldn't think.
Yeah. So fear obviously plays a role in that medical avoidance.
It certainly does. I think that's probably the major barrier for most people. So worries about discovering an illness or facing difficult treatments. Maybe you might feel, maybe it's something where you think maybe people are going to judge me because I've got whatever this thing might be. And depending on what we've heard from other people too, that may influence our feelings or our willingness to explore some of these options. And I guess the other thing that obviously that can make a difference too is access to medical care as well. That's the other reason why people might avoid as well, because they may not have ready access to the services that they need.
Are there any sort of cultural or social factors that can influence whether people will actively seek out medical help?
Yeah, we certainly know that this is a big factor for a lot of people. So in some communities, talking about your health issues it might be stigmatised, it might be seen as a sign of weakness, depending on what the social norms are, even what's happened within the unit of your own family and your family expectations over the years, whether you trust the healthcare system. So we know all of these factors can have an influence on people's decision-making about seeking out medical care.
You spoke a lot there about fear and things like shame. That's really concerning. That's something that people are worried about, but I guess it's a reality for people who are trying to seek out or should be seeking out medical care.
Yeah, it is. It's an understandable one. And I think for some people, for some matters, the biggest step is to ring up and to make the appointment and go and do it. And the good thing is that typically once you manage to do that, once you get there, hopefully you have a helpful, maybe even a positive experience with that. But the other thing I say to people is if you're concerned about whatever it is that you're seeking is to express that concern as well, so that the health practitioner knows that you've got some worries. Chances are, depending on what it is, they'll anticipate that or be looking for that anyway. But sharing that and speaking to that is also important.
I think in recent years as well, there has been a lot more discussion from a medical perspective about bedside manner or thinking of the patient's response and considerations in that perspective as well in recent years? Yeah,
I would agree with that. That's certainly been my experience in dealing with health practitioners. And I guess I've had a little bit of awareness of what happens in the training of medical health professionals as well, doctors and nurses and the like. So we know that a lot of that gets built into the training now. So we're seeing a broader education piece there for our health professionals, which is also really important.
How can somebody overcome their own fear or hesitations about seeing a doctor?
Yeah, small steps, I think. So scheduling a checkup just to meet with a doctor, maybe more so than for a specific test. And remembering that sometimes, depending on what it is, you might use the appointment as more of an information gathering piece. For me at my age, what are some of the things you'd recommend that I should be looking at and what does that involve? I think information is always helpful because it's often the fear of the unknown that makes us avoid things. Maybe you might take a friend or a family member with you for support. And as we said before, articulating how you're feeling about it is important, but we know the importance of health prevention. As best we can, we really want to encourage people to, if you're not sure about something relating to your health, ask the people who would go to the health professionals for it rather than going elsewhere.
And I think sometimes there's the saying that we're always our biggest critic, but sometimes we're also our worst advocate.
Yes, absolutely.
So if you take a mate with you or a friend with you or somebody who cares about you who will ask the tough questions on your behalf, if you don't feel confident to do that, maybe taking a bestie along is also a good strategy.
Oh, it's a great
Yeah.
strategy. And the other thing, if you've got quite a bit of information to absorb, they can help you to remember.
Yes.
Or maybe they can go along with, I know I did that for a friend once, I went along with a notebook and I wrote down all the things that were being said so that then they could check their understanding with me afterwards and so forth. Or ask your doctor to write it down, whatever the pieces of information are that you need. So if they're talking with you but not giving you written information, then ask that if that's how you process information best. Taking a friend, writing down some notes, getting some information, it's all a positive step in our health directions.
That's psychology consultant Dr. Jo Lukens talking with me about why we avoid going to the doctor.